All right, the United Nations General Assembly kicks off a two-day virtual meeting on the coronavirus pandemic today. Well, it comes as the virus continues to spread across the globe. More than 60 million cases have been recorded so far, with more than 1.5 million deaths from COVID-19. North and South America, as well as Europe, have seen a massive resurgence in recent weeks. In Asia, India has fared far worse than its neighbors. The UN conference is meant to address the negative effects of the pandemic on jobs, economics, and global trade and travel. I'd like to turn now to Professor Calypso Chalkidou. She is the director of the Global Health Policy at Center for Global Development. A very warm welcome, Professor. Good to have you here with us. Now, it's a very delicate balancing act for policymakers around the world. I mean, how should they balance economic losses, COVID fatigue that is setting in among the general public, and the still rising number of infections?
As you say, it's a very difficult balance. I don't think there's a straightforward answer, but I think what is important is to continue to persevere with collecting information, being able to synthesize this information, including the trade-offs, as you say, between economic damage and welfare damage more generally in people's livelihoods caused either directly by the virus or indeed by the response to the virus, and then being able to communicate this to the population to ensure that the trust levels are strong and building as opposed to waning, and so that people are on board the measures that governments take.
Now, help is on the way in the form of upcoming vaccination programs, possible treatments, and rapid testing. Do you feel that these solutions will be spread out, distributed in an equitable way?
Well, I think that, as you say, these are encouraging news, especially on the vaccines. I think we still need to look at the data. We need to rely on more than press releases. We need to look at peer-reviewed publications of the results. But in the meantime, our regulators here in Europe, in the United Kingdom, in the United States, are proceeding with emergency authorization processes, and that's important and understandable. In terms of equitable access, I think it's reasonable to assume that wealthier nations, those with those advanced deals with companies, will be the first to get the vaccine and distribute it to their populations, followed by resource-constrained countries.
Professor, how long away is there still ahead of us? I mean, people are so encouraged by this news of vaccines now being approved. But realistically, are we looking at still a year that we have to deal with this?
Well, there's a lot is uncertain. So I mean, I have to speculate, but I think in my mind, at least as far as the Northern Hemisphere is concerned, or the Western Hemisphere, the Europe, North America, I think, I'm hoping for a normal Christmas this time next year. I think it will take several months for the vaccine to be shipped after the authorization processes are completed, and then to be distributed in a tiered way, as you've been describing, high-risk groups first, and then on forth to other population groups, and then to establish that it is working. As you said, 2 doses may well be required, so we might be looking, most certainly be looking at those vaccination schedules, so that will take time too. And then we need to make sure that obviously it's safe, it works, how well it works, in which populations. So in parallel to this process, we'll have to sustain the social distancing measures, the non-pharmacological interventions, so-called NPIs, to make sure that we don't see resurgent peaks. So that will take time. It will take certainly several months.
Professor Calypso Chalkidou, Director of Global Health Policy at Center for Global Development. Thank you for joining us.
Thank you.
Let's take a look now at the latest developments in the coronavirus pandemic. The number of people hospitalized with COVID-19 in the United States has reached 100,000, an all-time high, as the pandemic increases the strain on healthcare systems there. Meanwhile, Greece has extended its nationwide lockdown for another week after a slower than expected decline in case numbers. And in Italy, that country will place strict limits on travel over the Christmas and New Year's holidays. A movement between the regions will be banned from December 21st. Russian President Vladimir Putin has ordered voluntary mass vaccinations to start next week. Moscow says its Sputnik vaccine is 95% effective. And we stay with Russia. That country's second wave of coronavirus has hit some of its regions specifically hard. In many cities, there are hardly any hospital beds left. Official statistics say almost 40,000 people in Russia have died from coronavirus. But media reports say the excess mortality in the country is 4 times higher than last year. Well, our correspondent Emily Sherwin went to the city of Ufa in the country's southwest, where it's mainly undertakers who experience these grim figures firsthand.
With a steady stream of coronavirus dead, speed is of the essence at the morgue. Every morning, the team from the funeral agency Ufa Ritual comes here to collect new victims of the pandemic. 29-year-old Artur Kinzikiev has been working at the funeral home for 12 years, but he says he's never had to bury this many bodies.
One time, there was a huge line of hearses standing in line outside the morgue. It was only then that people started to understand that death had really come. Call the relatives to identify the body.
This morgue in the city of Ufa is only for those who died of the coronavirus or had contact with an infected person. The bodies have to be sealed in plastic, the coffins closed. Many Russians feel their dead should be treated with more respect, Artur explains.
The relatives are often more tense than usual because their dead are handed over to them in plastic body bags. They aren't allowed to open the bags. I tell them that right away. Some people cry and demand that we open the bags. Then I have to explain that they could get infected themselves. This virus is no joke.
Yuri Kozlov has been in the business for 7 years. Today, he's in charge of the team of undertakers. He says since the second wave of coronavirus, there have been at least twice as many deaths in the city of Ufa. Funeral agencies have had a tough time keeping up.
We have more work, a lot more work.
Over 1 million people live in Ufa, the capital of the Republic of Bashkortostan. Government statistics say that only around 80 people in the region have died of the coronavirus since the pandemic began. But official numbers also show that during that time, over 4,000 more people died than in the same period last year. Coronavirus infections are spiking across Russia, but authorities insist the situation is under control. The undertakers aren't so sure. Today, Yuri Kozlov and his team are interring a 92-year-old woman. She didn't die of the coronavirus. That means her relatives can say their final farewell with an open casket, which is the tradition in Russia. Usually, funerals are big family affairs in Russia, but the pandemic has changed that. People are often worried about getting infected and stay away. So far, no one on Yuri's team has caught COVID. He can only hope it will stay that way.
In Russia, people say if it's decided up there that you'll get run over by a streetcar, you won't drown. Fate is fate. If the coronavirus isn't my fate, it will pass me by.
The next day, the team prepares for 4 more funerals. Artur and his colleagues hardly have time to worry about their own health. At the moment, they're just too busy.
Our correspondent Emily Sherwin reporting there, and she joins us now from Moscow. Truly heartbreaking stuff there. Emily, what's driving the increase in cases and deaths in Russia's regions?
Well, during the second wave of the coronavirus, the disease has really hit across Russia. In the first wave, it was kind of focused on Moscow, the capital. Actually, the numbers of overall deaths across Russia aren't that high comparatively with other countries like the US. Here, the official number is just 40,000, but there have been a lot of questions raised about those numbers since the beginning of the pandemic, and recently journalists have been pointing out that the official numbers of deaths across the country for the period of the pandemic this year are much, much higher than the same period last year. So those excess deaths are much higher than the official coronavirus statistics. So that could mean that COVID deaths are actually much higher. And despite questions over those death numbers, it's clear that the health system at the moment is kind of overstretched, even according to official information. The health minister at the beginning of this month said that around 80% of hospital beds across Russia were occupied at the moment. In some region, the number is as high as 95%. And there have been reports of kind of medicines running out, of doctors being overstretched, and even of seats, hospital seats instead of beds being offered in one Siberian city.
Are attitudes, Emily, towards the virus changing in Russia?
Well, surveys show that during the first wave of the pandemic, around 30% of people were concerned about COVID. Now that number has risen to around 60%, so it has doubled. But my sense is that people kind of really start to believe that COVID is a real threat when someone that they know is actually affected, or when they themselves are affected. And the undertakers that I spoke to in that report that we just saw also said that they know a lot of people who simply don't believe that coronavirus is real, and they don't necessarily believe the government on that. And also fatalism, this sense that if I get sick, then that's my fate. That's very widespread, a very kind of Russian attitude.
Meanwhile, Emily, Russia's announced it will be rolling out a vaccination program. How will that work?
Well, yesterday, Russian President Vladimir Putin said around 2 million doses of Sputnik V, one of the two Russian vaccines, is actually ready to go. And he ordered the government to start rolling out the vaccination program next week. The mayor of Moscow, the capital, seemingly trying to get ahead of everyone else, has today announced that people will be able to sign up to get vaccinated starting from tomorrow, and that vaccination centers across the city, 70 of them, will be open from morning till night on Saturday, so people can start getting vaccinated here in the capital from this coming Saturday. It's clear that that quick rollout is a bit of a political thing. Russia, since the beginning of this pandemic, has wanted to be at the forefront of the race for the vaccine. We've seen that in the numbers that they've been reporting on effectiveness. When a Western vaccine comes out and said we have 90% effectiveness, Russia kind of one-ups them every time.
All right, Emily Sherwin reporting from Moscow. Thank you. The head of Germany's Public Health Institute says he expects the coronavirus pandemic to claim many more lives. At a news conference, the president of the Robert Koch Institute, Lothar Wieler, said Germany has managed to stabilize the rate of new infections through restrictions in the past weeks. But he stressed the caseload remains too high. While Mr. Wieler said he was particularly concerned about the rate of infections in care homes, where increasing numbers of elderly residents are contracting the virus, and he warned that hospitals are coming under growing strain.
Wir sehen, dass in einigen Regionen auch Krankenhäuser.
In some regions, we're seeing hospitals reach the limits of their capacities, and as a result, are having to postpone surgeries or treatments. We also see the number of severe cases and deaths rising from week to week. And since both always occur after a certain time lag, we must expect many more.
All right, let's take you now to DW's political correspondent, Emmanuel Chaz, who is following this story very closely for you. Emma, what's behind the rise of these death rates here in Germany?
Well, Laila, you have to look at where the infections happen. Of course, more infections mean more deaths, but not only. This time around, the virus has spread much more widely and in places like hospitals and care homes where it affects vulnerable people. There's infections also among the younger population and among people over 80. In care homes, the death rate for people infected by COVID-19 is 20%. That is 1/5 of the people infected, while the first time around in spring with the virus more more localized, it was much easier to contain. And according to Lothar Wieler, much more needs to be done to protect those vulnerable people. He said, otherwise we can expect many more deaths from a virus that, he said, ultimately is up to each and every one of us to control by avoiding contacts with others as much as possible.
Emma, I'm going to put you on hold for just a second. We're going to continue our conversation after this because German Chancellor Angela Merkel has confirmed that a partial lockdown will remain in place until at least early January. But restrictions on get-togethers will be loosened for Christmas, even though some public health experts warn of the consequences.
Winter's coming, and German Chancellor Angela Merkel warned it could be a long one.
We had already made clear in November that unless there were significant changes for the better, it was highly likely that the measures in place until December 20 would be extended. And that's what we've now agreed to do.
With a record daily death toll reported on Wednesday, the partial lockdown has done little to turn the tide here in Germany. The question is whether we leave the country in this state of half-sleep, or if we decide at some point to introduce significantly tougher measures. We'll see how efficient the measures currently in place are. For now, the restrictions will remain in place until January 10th. For the vendors here at Berlin's famous Christmas market, this is not the season to be jolly, as visitors will only be allowed to buy their mulled wine and sizzling sausages to go.
We need to ask ourselves what to do. We don't know what will happen. It's not really a Christmas market, just a few stands. I was there last year before I flew back to Italy. It was wonderful. I think it's a real shame that there's nothing this year. I'm really sorry.
Restaurants and bars had to close when the partial lockdown was introduced in November. Many are now looking to takeout orders and loyal customers to stay afloat. It's a bit difficult at the moment, of course, but we're doing our best. We're open for takeouts with new offers, and our regular customers support us. We'll see how long it lasts. I really hope this situation ends soon. For many, the promise of a vaccine has offered a glimmer of hope. But until then, many worry it's going to be a long and lonely Christmas.
Let's talk now about Christmas with Emmanuelle Schaz. Emma, so restrictions are supposed to be loosened over the Christmas holiday. Is that a wise decision?
Well, it's something that Angela Merkel warned she couldn't guarantee. This is the plan right now. But also, for example, if you take the case of the German capital of Berlin, its mayor, Michael Müller, already said that there will be no loosening of restrictions in Berlin because the 7 days incidence, the infection rate is still way too high in the German capital. It is 170 per 100,000 inhabitants over a period of 7 days, which is way higher than the goal of this lockdown, which is to bring this number back to below 50. So there is a loosening plan, but at the same time, the situation right now doesn't indicate that it is in any case the wise move to make.
And they're not committing to it, judging by what you're reporting. Let's talk about the partial lockdown that is in place in Germany right now. It was meant to bend the curve. It is not doing that. Where is it going wrong?
Well, because it's partial, so it takes time for the number of infections to significantly drop. Right now, the light lockdown, as it's called here, has stopped the exponential growth of infections, but it hasn't significantly reduced the number of infections. Today, we saw a little bit above 22,000 new cases. On day one of the current lockdown, on November 2, this was 23,300 cases. So we stagnate with significantly more deaths. This partial lockdown now is set to be extended until January 10th at least. Some areas which are particularly infected with high infection rates, like Nuremberg in Bavaria, some districts in Saxony have introduced even tougher measures with people ordered to not leave their home without good reason. And Markus Söder, the state premiers of Bavaria, spoke of toughening measures nationwide. We heard it in the report. Either we leave this country in that state of half-sleep or we take action to tackle the virus.
All right, Emmanuelle Schaz reporting from Berlin. Thank you. Well, the UK on Wednesday became the first country in the world to authorize a vaccine developed by BioNTech Pfizer. While the US and the EU are expected to follow suit in the coming weeks, but doses of the vaccine will initially be in short supply, raising the question of who should be top of the list to receive it.
Everyone in the world who wants to get vaccinated against COVID-19 should be able to. At least, that's the idea. But demand for the vaccine is likely to be much greater than the initial supply. Now governments must decide who comes first and who must wait. Most agree that fair distribution should take place independent of a country or individual's ability to pay. In Britain, an independent commission has developed a multi-step plan according to the key factors of infection risk and age. Residents and employees in nursing homes take first priority. Next in line are those over 80 years old, and then healthcare professionals. Then high-risk adults under 65 can take their turn, followed by seniors over 65.
And the most important thing is to make sure that we get people, as many people as possible, starting with the most vulnerable, and then those who work in the front line of the NHS, vaccinated effectively.
In countries with federal states like Germany or the US, the decision will be left to individual states. The U.S. Advisory Commission recommends that residents of nursing homes and healthcare workers be vaccinated first. Germany is also working to create a system of prioritizing vaccinations. Chancellor Angela Merkel says above all, it won't be mandated. Nobody will be forced to be vaccinated. This is a voluntary decision. The question of who will be vaccinated first is being discussed with the Vaccination Commission, with the Leopoldina Academy of Science, and with the Ethics Commission. But I think I can already reveal this much. First and foremost, of course, we have nurses, doctors, and people in high-risk groups. Only after 60 to 70% of people have become immune to the virus will the pandemic be considered defeated. And reaching that point worldwide will still take time.